Heart disease and stroke kill more Americans every year than all forms of cancer and accidental deaths combined. But there is some good news. Deaths due to heart disease and stroke are down. And the even better news is that we can take actions now that can decrease our risk. Here to join us and to help us understand this is Dr. Joy Lincoln. She is president of the Milwaukee American Heart Association. She is also a physician and researcher at Children's Wisconsin and the Medical College of Wisconsin. Thank you so much for being with us, Dr. Lincoln.
Thank you for having me.
The most recent study from the American Heart Association found that there was a decrease in deaths due to heart disease and stroke. Why is that happening after so many years where the numbers were going up?
Yeah, it's all great news, right? In the last 5 years, our numbers have fallen. We have a lot of research going on. We're understanding now what we can do to ourselves to prevent this from happening in the future. The bad news is it still remains the number one killer. And so we still have to keep doing what we're doing to lower those numbers further. But we have made great strides in the last sort of 5 years, understanding what causes heart disease and what we can do to prevent it.
We're going to talk about that a bit more in terms of some of the things that we can do working with our physicians to take better control of our health. But as part of this just perception, do most people realize that heart disease and stroke are so deadly when most people, I think, still think of cancer as being the disease that is the most deadly in the United States?
Yeah, I think one thing is that not everybody knows they might even have heart disease. So they may feel really well, fit, and healthy. But I think we all know someone in our family or our friends group that may have struggled or, had an incident of cardiovascular ill health. So it is much more prevalent, we think. And, we estimate about 46% of people in the US have heart disease. That's almost 1 in 2 of us are walking around with heart disease. The good news is about 70% of those cases can be prevented if we follow some simple rules. But yeah, I think it is very underestimated and underappreciated how severe cardiovascular disease is.
How significant can that change be if we just follow some lifestyle changes? Now, lifestyle changes are hard to make,
Yeah.
but can we see a significant decrease in our risk if we make some of those changes?
Yeah, absolutely. And I can't tell you enough how important it is. And when I talk to families, patients, it's all about listen to what your body is telling you. Take some very simple approaches and change them in your everyday practice. Eat better, be more active, quit tobacco use, get some sleep. Know your baseline numbers. What's your blood pressure? What's your cholesterol level? And just think about those things and put them into practice piece by piece every day.
A lot of times when you're talking about knowing your numbers, understanding what numbers mean, if you go in to see the physician for a checkup or for whatever reason, they take your blood pressure. People don't always understand what those readings mean. And there have actually been some recent changes that people may not understand.
Yeah, the guidelines are changing all the time. My number one feedback of that is talk to your physician, ask them. There are no silly questions, and don't give up until you leave the office of your physician feeling satisfied that you fully understand what does that mean. Or if you use somewhere public at Walgreens or at a local library, the American Heart Association has now put blood pressure monitors in local places for you to use. You might get that number and walk away thinking, what does that number mean? But you can go to the website for the American Heart Association and understand what your numbers actually are telling you.
One of the things that you just mentioned briefly is that there are things that we can do, and the Heart Association has what it calls the Life's Essential Eight.
Yeah.
One set of 4 health behaviors, one set of 4 health factors. So
Mhm.
let's talk a little bit about those so we can have a better understanding of them. And let's talk about the health behaviors first. What are
Yeah.
some of those behaviors that we can change that can help improve our health?
Yeah, I think the big things are really when we talk about hypertension, which is high blood pressure, obesity, so weight management, eating healthy, and the other piece is blood sugar, so diabetes. And while hypertension and diabetes have come down, obesity has come down in the adult population, but it continues to rise in those under 19. So we really have to take control about our cholesterol levels. What's our blood sugar? What's our weight management? And all of that comes around a more active lifestyle.
One of the other things that's recommended is getting good sleep. Easier said than done for many of us. Why is sleep so important to our heart health?
Yeah, I just feel it's many ways. I think of physical health in terms of sleep, of just relaxing your body, a reset, recharge. I also think for mental health too, getting a good night's sleep, waking up refreshed, and really think about how many hours do I need. And it's easy now, we have smartwatches, smartphones that tell us what our sleep score was each night. And so just think about, how do you feel when you wake up on a morning? Do I need more sleep? Am I tired? Because if you are tired, it's your body telling you you need to slow down and you need to get more sleep.
One thing that we also can have some control over that impacts our heart health is stress.
Mhm.
Do we understand in general how much stress can impact our heart health?
Yeah, I think sometimes we put our stress on the back burner, right? And I think we always sometimes neglect our own self-wellness for the sake of others. I'm a true believer that if you're not at your best, you can't be at your best for others. And so I really think we have to think about, how does stress, in terms of mental health stress, physical stress, what's the burden of that on our heart health? And it is huge. When you feel like you're getting stressed and anxious, your body physically tenses up. And if you think about that, your blood pressure increases, and it's hard to lower that once you get to that point. So I think it's all about being aware, listening to your body. When is it telling you that you're anxious? And when you do feel that way, think about, what do I need to do to reset myself? Whether it's going for a walk, taking some deep breathing, getting a good night's sleep. And I think once you start to pull away those layers and understand what your body's telling you and listening to it, you have to react.
As you mentioned, taking a walk, exercise, that's one way that you
Mhm.
can reduce that stress.
Yeah.
But we struggle with that as a nation. Where I was looking at this report and some of the data, only 1 in 4 adults meet the national standard for activity. And it's even worse for our kids, where it's
Yeah.
only 1 in 5.
Mm.
What are some of the things that we can do to begin to change that?
Yeah, and when we look at those numbers, we think about some of the adults that sit at their desk for 8 hours a day. And so again, we have now devices that tell us to stand up and move. And I really think it's very intentional, and you have to be very purposeful. But it has to be part of your lifestyle, your culture, that you do everyday activities. So getting up, just walking around, the weather's getting nicer now, we're in spring and we're getting there, but just taking 5, 10 minutes a day just for yourself. Walk. If you get to the staircase or the elevator, you've got a choice. Let's take the stairs today. Let's try that one day a week, 2 days a week, build up on it. But it's really important that we stay active. And it's not just the, walking outside, but the stretching, the mobility, really trying to keep your body in its best shape it can be.
Because all of those things that you talked about, reducing our weight,
Yeah.
controlling blood pressure, getting more exercise, better sleep, these are all things that we can control that can help make our lives better.
Yeah, so much better. And as I say, the numbers are staggering. Up to 70% of heart disease can be prevented if we follow those simple rules. And it's a generational thing. We see now that, yes, obesity in adults is coming down, it's increasing in our kids. So we have to make sure that we're passing this information on. And it's a family lifestyle, it's a community lifestyle. We all have to be part of that. And being very aware of those very simple changes really have a huge impact. And, we have one heart. What we're born with is what we have for the rest of our lives. The heart beats 100,000 times a day. So if you think how much work your heart has to do, you have to look after it.
An excellent point and also excellent advice. Thank you so much for being with us, Dr. Lincoln.
Thank you for having me. Thank you.
And if you want more information, you can always go to the American Heart Association's website. That is it for us this week on Connect MKE. Take care, be well. We will see you again next week.